So we're having this special session. So we thank you, all the risk analysis working group members who made it to this special session. You've all received a mail with a document attached, which is the latest version of the operational guide on the root cause analysis, which is this tool that was already presented to the risk analysis working group sometime in July or August by Nolwenn, who is connected. And we had provided some overview of the tool. And we had told you that we would be field testing it in a couple of countries, which happened in Guinea and Cameroon. And then we said we would go back to you to provide you with some feedback, lessons learned on this tool. So some of the lessons learned were shared by Nolwenn at 2 days ago, or was it yesterday? Yesterday, during her presentation. In the attachment, we sent you, so we first, just to finish on this, so some lessons learned were shared by Nolwenn. And now what we are doing is some consultation meetings with the vaccine delivery working group and the risk analysis working group on specific aspects of the toolkit, knowing that there are also certain lessons learned that we made at the with the countries and with us at the secretarial level, at the team, the level of the WHO yellow fever technical team. So we do want to make some adjustments in this tool, in the way it is being, it will be used in the future. But as far as what we would like you to do is to comment more specifically on the exposure aspects. So I don't know, Nolwenn, if you want to share your screen and maybe show a slide showing the three categories of the three types, the three categories of variables that are assessed. We will assume that everybody has some knowledge of the tool, that you've all listened to the presentation yesterday. But maybe if you can just show that slide with the three branches, and I will make a few comments as to what we thought, some general comments on this particular aspect of the root cause analysis, the exposure one. And then I will let you maybe pursue and have and open the floor for comments.
Okay, so good morning, good afternoon, sorry, everyone, it's even afternoon here. I shared my screen, do you see it?
Yes.
Okay. Sorry, I try. So we thank you, Marie-Ève. So we made just a bit of change. I think it was already divided in three main groups for the increased exposure. So we put three main groups. So anthropogenic factors, vector factors, and non-human reservoir. So I try to, because I don't see, sorry. Yeah, so that was the first level of, so the first level increased exposure, sorry. So in terms of second level, so under the anthropogenic factors, so there is always what is the behavior change in the forestry activities. So all the economic activities or deforestation that happen due to agriculture, etc. And then the second level cause it's increase in vaccinated population. So if, for instance, there is in the area an increased movement of unvaccinated population or increased density. So of course, according of if we have a urban and rural outbreak, that will differ. So the question, as you could see in the tool, according of the outbreaks that we have. And then we have another group, vectors factors, where we put an increased density of IDES. So what will be the reasons? So either increased condition of the condition for breedings or increased longevity, and then increase transmission rate. And then after we have the group of non-human reservoir factors with the increase in the number of primates, non-human human primates, and if there was a non-reservoir of yellow fever. So it's mainly that is what we have as a three groups. So yeah, I don't know how you want to proceed. First, if there is comments on this slide, or if somebody wants to say, yeah.
Maybe just to add something that maybe it will be useful for the members here is to get some feedback as to what you managed to get when you use this tool in Guinea and Cameroon. And just to remind everyone that so you know the idea was to look at the reasons for yellow fever outbreaks in the countries, and the way the tool was done is to assess a recent outbreak. Sometimes it was not possible to assess the most recent outbreak, but the idea was to select a district where there had been a recent yellow fever outbreak. And so this whole assessment, the vaccination factors, the surveillance related factors, and the exposures, they are meant to be, they were meant in the first version of the tool to be assessed at the district level. And from the reports that we had, what we saw is that actually there was very little data. Of all the data that's presented here on the slide, actually, and this is where you can correct me if I'm wrong, is the only information was about population movement. That kind of information was available at the districts, and that was qualitative information given by district authorities about having about the types of activities that local population had in the forest, and whether there were IDPs also. But in terms of the, for example, all the variables related to the presence of the vector and even on the non-human primates, I'm not sure that there was any information at the district level. But at the national level, you managed to get some information. And this is, so I'll let you comment on that, on if you can provide more feedback on how did it work in Guinea and Cameroon.
So what we had in Guinea, we had actually in the district level, we had information on temperature and rainfall. So that we had that in Guinea, not in Cameroon. Also, yeah, the only information that we can have regarding the IDES is if there was a previous entomologic investigation in the area, where we can look at what was all this index of Breteau or house index, etc. But it means that the investigation has to be made. And otherwise, in terms of behavior change, so that we can sometimes have the information is more oral information that we have when we exchange with either the responsible of the district or people of the médecin chef of the district, of all the key person of the district. Yes, in terms of numbers of primates, that is the same. We don't have we have oral information about it. Actually, the number of primates doesn't increase, but decrease actually. The two areas where I've been, but that is oral information. Yeah. Yeah, so some information are mainly, we can have some information in the district level, but is either oral or yeah, and the only one we had by paper was the one of rainfall and temperatures, and information on IDES if entomological investigation were made. Is it answering to your questions, or you what you wanted to?
Yes. So, and just to give more details on the entomological assessment, we're talking here the entomological assessments that are done around a confirmed yellow fever case. These are not district level surveillance data.
Yeah, no. It's not surveillance data. It's not routine surveillance data. Doesn't exist. Where I've been, it was not. It was not made. But if I'm not mistaken, so yes, it's mainly when you have an investigation around the case, a confirmed suspected case, before it was confirmed or after. But the thing is, sometimes you have also assessments that are made. I've seen some reports that are made, but it's just a sporadic assessment. It's not a routine surveillance of ALS. Yeah, correct.
So maybe we can open the floor to questions first. When you look at these factors, and as you see, they're broken down, like, what do you think of that? Is that because behind each box, there's like a lot of questions. And that's what was one of the learnings of this root cause analysis, is that it's very time consuming. I think overall there's like 300 questions. And so each variable should be useful, because behind its work and questions and there's also, this is a feedback we got from discussing here with countries, that there is a willingness, an interest from countries to use that tool by themselves. So the idea is also to simplify as much as possible. And the other thing is that we know that the risk assessment does some national assessment with some of these variables on an annual basis, to rank the high risk countries. How can we leverage this when you see all these? I think we lost the presentation.
No, sorry, Marie-Ève, I need to open also my computer, so I cannot share and look
maybe
at.
You can share it, because
so I'm coming back to you very quickly, but I just need to check something.
Okay.
About the number of questions, actually, I was looking at the number of questions that we have, because I think it decreased a bit. So,
but may I say something? I think that if there are things that are collected at other moments, it's fine. It will simplify the root cause analysis. But the question is, are we, when we speak about increased exposure, are we missing something, or is there factors you think should not be considered? This is perhaps the question we should get, because after the number of questions, or if we can find it elsewhere, because it has been done in another circumstances, then it will be easier to do the root cause analysis. But the question is more in terms of, when we think increased exposure, do we have all the factors there? And do we miss anything, or is there factors that we should not consider because they are not linked with an increased exposure? Perhaps that's also what we should get. No, you don't think, Marie-Ève?
Yes, exactly. Yes, Erin.
No, I was just going to say, just thinking about some of this, is the purpose of the root cause analysis to be action oriented? Because you're not going to be able to change the temperature. So, it may be a change in the climate or the temperature that drove it, and I think it's important to capture, but how in depth do you need to go about the increase in the mean temperatures? Is that really going to tell you something, that's meaningful or actionable? And I think, and so that, I guess that's one, just my general reaction is yeah, that how I would think or present or aggregate things are different, but admittedly I didn't look at all the questions, and it may be feeding into it. Some of the basic things I'd want to know is, more about the demographics of the groups that are being affected, you know, and I think that's part of the regular investigation. But I think the way that the tables are laid out, they're like gaps or issues versus what are you asking? And again, it may be the questions feed into each of these larger tables, but it's hard because, you know, what if you have a case in a miner who just came back from being in a mine in an endemic area and they were unvaccinated? You know, I think that you know what the answer is. You don't need to ask the 50 questions, but you do need to ask about the other miners and, you know, figure out why there might be population immunity gaps in that group. So I guess it's, and also, you know, just while I've got the floor, you know, you talk about forestry activities. Well, forestry is just a sylvatic transmission cycle in Africa. The intermediate transmission cycle is actually the most common way that people are infected. We're not talking, you know, maybe you mention it, but activities or movements in savanna or migrations of people through areas at risk. These are things that I don't see captured, but again, I apologize because if it's in the questions, it's just, a lot of it is the emphasis on increase. It could be just changes, you know. These aren't necessarily an increase in the non-human primate. A good example is in Cameroon before the more recent outbreak. It was a deforestation activity that happened in neighboring Nigeria cross state that led to the migration of non-human primates. So, you know, understanding, is it that country? Is it the area? Is it knowing what's going on around it? It's, I think the task is incredibly challenging and you've done a great job in capturing it. But I think in my mind, I would aggregate it a little bit differently and also think about what is actionable. Or do you still want to define, well, it's due to La Nina and the increased rains and or whatever, or El Nino, I'm mixing them up, you know, in temperatures that probably drove the reemergence of yellow fever. What are you going to do? You know, and I guess that's the question, a larger question for the root cause.
If I may just answer on this, it's a very valid point. Do we want to have, do we have findings where we can take action, or do we want to have findings to explain what happened? And I agree with you, we cannot do anything about El Nino. When it's there, it's there. But perhaps what can be done is if we know that it's because of these factors, then perhaps you would like to increase all the preventive measure because you know that this problem will be there for a certain moment, and then therefore there is a good reason for increasing vector control activities, or I don't know. You see, so I agree with you. You cannot really act on the factor, but because of the factor, because you know that this factor is there, you can perhaps put in place some preventive measure. So it's that we need to decide what exactly we would like, but. On my side, I feel that there might be factors that are found on which you cannot directly have an action, but it can help either another sector to alert another sector who can take action, or it can help you for putting more preventive measure if that is possible, you see. So I don't know, I have this yeah, I wanted just to put this as well as a comment. Thank you.
Yeah, no, I appreciate that. And I agree that it's probably useful to note what the issue is if it's feasible. With that said, El Nino doesn't or always impact the same area the same way. But I think it's a question of if you have 300 questions and it's found to be onerous, maybe thinking about the pertinence of the actual data to first inform, you know, a corrective action or public health action, and then second to get at the causality. And that might help weed down some questions if it is considered to be an onerous activity, given the number of questions.
If I can just add, it's true that sorry, Norwen, go ahead.
No, it's just, I just wanted to precise that the number of questions that we have is just a precision, and I'm sure you know, and it was what explained yesterday, is the number of questions that are on the questionnaires that are not the total number of questions that we are going to ask during the investigation, because it depends really on what we have at the first level, then what we have at the second level. And according of what we find, we go on with the questions. And so that is, so there is not 100 questions from all time. It really depends on what we find, where to go deeper. And also, as I said earlier, but also the type of outbreak that we have. If we have an outbreak in a city or not. So all questions are not asked during a root cause analysis. It was just to make a precision, but yeah. Thank you.
And the characteristics of the patient, this is also studied earlier. So that's the first step, no? So that's what guides as well. And at the first step, you look at the basic demographics, but also you know if the patient have moved or not, and so that guides you. It can be very well urban, but the start is in a rural area. So then you will keep some factors eventually that are linked to the rural area. So that it's yeah, just to mention that as well, because she made a comment on the characteristics of the patient. Sorry, Maria.
Yeah, and I think that's where the granularity is lacking. Epidemiology, time, place, people of yellow fever in the country. That's where you really want to hone in those questions that you ask and get down, because that will probably inform what you're doing. And you may, again, already be doing that, not seeing the complete thing other than the operational guidance.
Louis made, yeah.
Maria, you...
Yes, just to say that maybe this root cause analysis model is not so adapted for yellow fever, because this is the reasoning for measles, but here we have for yellow fever all these other, yes, environmental, let's say, factors, and so it's a bit tricky, and maybe the analysis of the population affected by the yellow fever outbreak is more important and can actually be the first step to see which to know where we need to go deeper in terms of the exposures. And maybe we would need to take an example, like have like the example you were giving, a non-vaccinated minor, and from that see what needs to be investigated, and it would be more in the vaccination part. How come this person and his community has not been vaccinated? And maybe there's no need to look at these exposure factors, these exposure variables. I don't know. So I'm not even sure of. Well, I'm questioning whether it's adapted. And maybe if we take the high level.
You mean about increased exposure? You mean about this part is what you mean? Sorry, I don't understand what you mean.
Yes,
Okay,
and
okay.
maybe actually, so like you were saying, no, when not all questions are asked, it's kind of a yes, no. With first level questions, right? So if there is if you find something with the first level question, then you go deeper and you ask further questions. That's the process, right? So, for example, what would be the first questions or the first things looked at? We see here anthropogenic factors, vector factors, non-human reservoir, like. The second level would be asked systematically for all patients, not patients, but for all outbreaks that are assessed.
But not, for instance, if you have an outbreak in a city, you will not ask for the increased number of primates. But the things is other, because we look at just at the area. So the things was when we decided to do, when this toolkit was asked, it was to look at just one specific area where the outbreak or the case was. So really depends on where it will be. If it's, as I said, in a city so after you have all the question of if the patients travel, etc. But that is in another part. So it's not in the part that I don't know if we shall use this part. Is before going. Let's say you have the operational guidance, and before going to and the immunity gap and the surveillance gap and the increased exposure, you have another part as well where there are all the information on the yellow fever cases with the characteristics. And you have all this information about the vaccination status, if they traveled, etc. If they have a job, a work that could increase. I've spoken about mining and or working in the forest. So the second level, but so to go back to your questions, Marie-Ève, so yes, you will have some information that we will collect. Then there is all this second level. So I don't have, I cannot, or I have to unshare the screen, but I don't have my the questionnaires in front of me. But it's just very quick questions. I mean, to see if there is an increased number of primates, is just to know is a yes, no. Increase in vaccinated population to see if there was population movement, and if there was population movement, the ideal result will be to look at where these people are coming from, what was the vaccination coverage, where they came from, etc. But the second level is really short. Increase density, it would have, what I put, I don't know if it's correct, but it was to look at index of Brotteaux, index of House, and voilà, also the some of the indicators that you collect also for the risk analysis of the country to see if there is the change in variable over time. So that is, you have also document review on this level, so it's quite short. And then after you enter deeper in the questions. But the second level is quite quick. It's not really, it doesn't take so much time. Actually, I would say that in the increased exposure is not the questionnaire that takes more time, actually. It's not so long. I don't find that so long, but.
Yes, go ahead. There is a comment here from the room.
By the way, it's my first time to see this. Apart from what was discussed the other day, I have a question about this. Explains which I agree totally can doable, but how to do it? Do we have first of all a questionnaire, and then how to make them more objective than yes and no, which is more subjective? Has the forest increased? By what numbers, or how to put it to make sure that it is more objective than I can think the vectors have increased. Someone might think that they are still the same. Is there a mechanism to measure that, so that if it's done in Cameroon, the same done in South Sudan, we'll get the same results because it's more objective? Over.
Yeah. Thank you. So the thing is, ideally, is to have the information by a report. So it's to have the information in a document review. So in the questionnaires, you have, I don't know if the question is written asked in that way. Sorry, but let's say, is there an increase in the number of primates in the area? Is the person who is conducting the root cause analysis to tick yes and no and to describe through the document review. So it's ideally is to have the information either on reports, and that's why we go to see people who work in the wildlife area or environmental area, etc. And the things is, as we discussed, we said at the beginning, is sometimes it's difficult to have this information. So, and that is true that it can become subjective because it's a person who answered to you. I had the example of Guinea where I had somebody who worked for a long time in the area and knew about all this problem of deforestation, but there was no reports because it started over 10 years or 15 years since 2010. So yes, it can be one of the limits. And was, as I said yesterday, is one of the difficulty sometimes to have the documentation, but ideally is to have this information through documentation. But after, the question is just not to enter too much in detail, is to put yes, no, and is the person who conducts the root cause analysis who answer to this.
Just to mention that the question yes, no, I fully agree with you. You don't have so much information with that, but it's the type of question that helps you to make a triage on where you should go deeper, you see? So, and when you go deeper, obviously there is more to know, and there is also it's mixed methods because you have some interview, you have so it's not all is not yes, no. If not, you're totally right. It would be very difficult to answer to that. But there are some triage questions where it's yes, no, actually.
Yes, just to say, I agree. It's a big limit in this tool. The fact that there's no cutoff, there's no threshold like you might expect in some other type of assessment like this, which helps you interpret the findings. Here, it's yes, qualitative information that you get, and yes, and that's the, and so first we found out that oftentimes there's a lack of accurate data, and even for the vectors, these, again, the data from the entomological assessments, it's not entomological surveillance data, so it's only the entomological indices that are calculated around the home of the patient, and there's no way to compare that because it's very unlikely that there was an outbreak the year before, so we can't even compare. So that was one of the frustrations we had with the field testing for this part, is that lack of accurate data. We don't have, we didn't get, and we don't have these thresholds or cutoff. And I wondered if so we have Nestor, he's here from Sekou from Guinea. What did that give in Guinea? This whole assessment, like maybe now when you have that on top of your mind, like I think it will help us see, was that useful? I think there was the changes in the behavior, deforestation, so again, qualitative information. And what else did we learn from Guinée? En Guinée, qu'est-ce qu'on a appris je pose la question, c'est que pour cette partie-là, en termes de facteurs environnementaux qui pourraient expliquer la recrudescence de la fièvre jaune?
So, Sekou wants to answer, maybe, sorry.
Ok, oui, merci. Comme vous l'avez mentionné ici, moi je n'avais pas vu cette analyse encore, mais parce que tous les éléments sont ici. Les facteurs environnementaux qui ont impacté ou bien qui ont presque, sur lesquels on peut s'appesantir pour dire qu'il y a eu un changement par rapport à la survenue des cas de fièvre jaune, c'est surtout l'agriculture. On a l'agriculture chez nous qui est une agriculture extensive, donc les gens partent chaque année changent de milieu pour aller faire l'agriculture. Deuxièmement, on a les activités minières qui sont intenses, qui sont très intenses, principalement dans deux régions. Les régions d'ailleurs, lesquelles sont impliquées dans la survenue des cas de flambée. La région de Bokeh, où se trouve Koundara, la région de la Haute-Guinée, où se trouve comment dirais-je, les 2 districts ont enregistré les cas de fièvre jaune les dernières années. Il faut aussi noter les parcs animaliers où il y a les primates non humains qui sont voisins à des lieux d'habitation des populations où les populations partent trouver par exemple la nourriture, partent trouver le bois. Donc, pour moi, les facteurs environnementaux expliquent, avec les couvertures vaccinales qui sont très faibles pendant plus de 10 ans, cela explique un peu la survenue des cas des flambées au niveau de notre pays. Bon, les changements climatiques, il y a une catégorie de population à risque qui n'est pas apparue ici, dont on ne parle pas souvent, ce sont les pêcheurs. Les gens qui font la pêche fluviale. Chez nous, il y a cette activité qui est très intense à l'intérieur du pays. Et ces gens, généralement, la pêche là se fait nuitamment. Voilà. Et en Haute-Guinée, c'est une activité qui est très intense. Dans les régions de Farana, là où est survenu le dernier cas, c'est une activité qui est très intense. Donc, cette catégorie de population aussi est très exposée. Le cas de Guékédou, par exemple, on l'a mis dans le plan. C'est un cas qui est survenu dans une zone où cette activité est très intense. Mais généralement, dans les analyses, elle n'apparaît pas. Donc, ce sont des travailleurs forestiers. Ce n'est pas pour couper du bois, mais les autres activités comme l'agriculture, le maraîchage, la pêche, aussi les exposent aux piqûres de moustiques. Merci.
Yes, so Sekou from Guinea, I'm just going to quickly translate, but he's mentioning all the different work-related activities which happen in the forest environment. But what I'm not sure is that if the evaluation showed that there was any increase in that would explain an increase in yellow fever outbreaks. And I think that's what the objective of the tool is to see any changes in these activities that could explain an increase in the number of outbreaks. But yes, all these informations that were gained from the assessment were very useful, but it's more like a mapping, like a one-shot assessment of the risk, but without being able really to compare in a way we would like to compare.
So can I jump
Anyway,
on, please?
Yes, go ahead.
Yeah. So actually, we said we have learned a bit, not a bit, we have learned from Guinea. We were evaluating two outbreaks, one in Kundara and one in Dabola. What we have learned in Dabola is actually there was a lot of forest deforestation due to agriculture in the area. And also a movement of the population who went over the winter in the mine in the north, if I'm not mistaken, c'est Koukou, in the north of Guinea. And so that was for Dabola. And actually there was one case that, there was one confirmed case several months after in the same area. So we have learned that. In Kundarat, what we have learned also is next to the Senegal border. And so we have learned of all the movement of population that was increasing when people go to work in the area and come back. So we could have learned some information for both outbreaks in Guinea. The things also just to mention, we could not enter more in detail for Kundara because I didn't go to Kundara due to time, the time that I had. So I just went to Dabola and we had interesting talk with the people involved in the agriculture, in the environment, and another person, sorry, that I forgot, and who could actually discuss about all this agriculture and deforestry in the area. Thank you.
Are there any thoughts on all this? I don't know if some of you had the chance to look at the questions, and I'm looking here on the screen. We have increased conditions for Aedes species breeding, increased longevity of Aedes species, insecticide resistance. What are your thoughts on these things for this type of evaluation.
Yeah, so just to
Any
mention also,
thoughts?
sorry, is just so what we've put here in terms of the 6, it was just to have something a little bit clear. And what we have put here, it was through literature review or the document review that we have seen that could explain an increased exposure. So that's why it was put in that way. And yeah, maybe it's not relevant because impossible to find the data. But the first time when we designed this disease tool was not to see, but it was really to also identify what could have led to this outbreak. And after, as we implemented in the field, to see the pertinence or the possibility, as you said, also the possibility to collect the data, and sometimes it's not possible.
And perhaps we need to keep in mind that you will never find a cause. It's several factors all together that can explain the problem. So it's not because there is deforestation that there is a risk. Of course, that's increased the risk, but there are other factors. So that's the reason why you explore different factors to know if they eventually could be important or not to consider, you see. So and there might be some factors who are not at all the reason, but there are some that might also explain the problem, and it's the sum of all these factors that together make the problem, and that's why at the end of the root cause analysis that has been done in Guinea, there is not one solution. There are plenty of problems that could explain altogether the re-emergence of the problem, you see. I think it's very important to keep that in mind. Over to you.
Any thoughts, even general impression of the tool? Are we heading the right way? Would it be a simpler way to assess this? Is it all pertinent? It's true, Corinne and Norwen, that we had you may not have followed all the discussions we had here over the last 2 days, but we realized actually at the end of the 3 days how complex yellow fever transmission is, and how much we don't know. We were discussing even about urban transmission, and the fact that you can have urban cases without having urban transmission. And we had a nice presentation from Brazil showing this. So there is sylvatic transmission that is giving rise to urban cases. So things are not so straightforward in yellow fever. So I think we have to keep that in mind also. Here it looks quite simple, yes, no, but yes, we need to think about all that, and take into consideration also the complexity of the epidemiology of yellow fever. Erin.
Yeah, no, I think what you described that you've got out of the investigation is very, is useful, but incongruent perhaps with the way that the tool or the visuals are laid out. In many ways, I think you could stop at the second level and then refer them to the appendices in the set of questions, and maybe rephrase the second level a little bit more to be, thinking about it. Because when you start throwing in, insecticide resistance, there's no mosquito surveillance in any place. So why are we, putting things like that on there? And I know you're trying to hint towards factors that are, but that's artificially suggesting that there's more importance of those factors when there's a series of questions that you go through to get that. So maybe that's just my general reaction to the way things have laid out. Again, just having the operational guidance and not having reviewed or had access to the questions in detail. You know, I think the root cause analysis is useful. It's just structuring, you know, the operational guidance in a way that will be effective to get the answers of that. And essentially what you're trying to do is a good epidemiologic investigation. A good epidemiologic investigation will tell you what are the most likely factors that are leading to it, and it's multifactorial. But I think you're trying to put that down on a piece of paper. And I applaud you for doing that, but it's just hard to conceptualize some of these third level diagrams and maybe stopping at the second level and just talking in not even behavioral change in forestry activities, but changes in land use, you know, and changes in land cover. That's actually what you're trying to capture.
Thank you for your comment, Erin. Just a question. You speak about the slide that is shared, or you speak about in the questionnaires? Excuse me, I misunderstood.
You know, in the slide that you're sharing, that third level, I think, is creating confusion for me. You know, but I think the questions and the answers that you were able to get to those questions, you know, probably is the most useful, but aggregating it to say these are questions that pertain to the second level of this, you know, or if there's no mosquito. And again, I apologize because I have not seen or reviewed the questions in detail, and I think that's the missing link in my mind.
Yeah, okay. No, because what I put, it was just to see, okay, in the vector factors, if there is an increase of density, what could be the reason? And it was here just to present how it could be. In the questionnaire that I put, I mean, there is all the reasons, and the things is I shared, because the plan also was to have the questionnaires in two ways. So the one I shared, because I had to finish the other one. The one I shared is to make easier to look at the question was to go through to the logical questions, because otherwise there will be also a set of questionnaires that will be shared by people who are interviewed. But it's more difficult, I think, to follow where we want to go by that way. So in the questionnaire, that's why I put the logical questions. But in the slide, yeah. Okay, okay, thank you. Yeah, I tried to do like it was made just to see what could be what would be the result of behavior change activities. It could be because there is increasing forest encroachment or increased change in the forestry economics, etc.
No, but that's obvious that here you on a slide, you just have a summary.
So
I can understand that
well, just to give
when you read the third level, it doesn't really ring a bell because it's just a summary. But yeah, it's in the questionnaire is more detailed actually. But again, not all the questions need to be used depending of what you find at the second level. You need to keep that in mind.
And the third level, after maybe it's not in the increased exposure, but when in the vaccination, actually the one who is the more where you have more levels in the vaccination gaps, immunization gaps, where yes, of course, at each level you remove some question because you go is a pathway. It's like that, yeah.
So unfortunately, we have to move to another meeting, but thank you so much for all these preliminary comments, and really don't hesitate to send further comments by mail, because the review process anyway will it's not finished, and it will take a few more weeks or months. So please take a look at the questions and send any feedback on any area that where you feel comfortable. And the other thing I just wanted to say is that even though like here it seems we're criticizing a lot, but I wanted to remind everyone that it was so helpful to have a discussion on these exposure related variables at the country level, because it was really an opportunity to meet with the One Health focal point at the MOH or the country office, and to engage in those types of discussions, which are not happening when there's a yellow fever outbreak. It's only the EPI program that's involved in the emergency. So that was, it's actually something that was very positive that came out of this, of trying to look at these factors, even though there are a lot of limits. Yes, I wanted to say this, that it's been, it was useful, and people, I think, interviewed looked at the MOH looked at yellow fever differently, and I think gained knowledge on the disease, the transmission, and the complexity of the disease. So that was one good point. So we'll have to close. Thank you, everyone. I don't know if there's. Thank you, Nolwenn and Corinne, for being available.
Thank you for the first comment also that I received. So thank you very much.
So we'll be in touch. Thank you, everyone.